Good evening. Good evening. I know you are exhausted, but this last bit, I'm sure we will not keep so much time, so just relax. In the supply chain sector, I will say that the worst disruption ever that has happened is as a result of the COVID-19. But just as we had the COVID-19, we thought everything was just fine. And then surfaced the Ukraine-Russia war. Now, but what are some of the impacts that we had? We are all conversant of the fact that supply chain linkages in terms of product lines were shut, export and imports prices skyrocketed. Today, you are aware of skyrocketing prices, high cost inputs, and these have repercussions on the health sector. In fact, it had repercussions on every sector, but particularly because of our focus on health sector, that is why I'm talking about health sector. Otherwise, I haven't seen any sector in business in this world that had not been impacted by the disruption of COVID-19 and the Ukraine-Russian war. And for me, from the supply chain perspective, my greatest innovation is that prior to this disruption, the word supply chain was not even known so much. It was in the academic sector and then few organizations. But today, every business sector had heard of this concept of supply chain. And I believe what is important and my greatest innovation is to build resilience. It is a game changer. Otherwise, this disruption brought high cost in the health sector. In fact, according to McKinsey & Company, the expected estimation that they made from 2018, the healthcare expenditure was about $8 trillion. And then they are estimating that by 2040, it will be about $18 trillion. And so this is huge, and it is as a result of all these, disruptions as a result of COVID-19, and then the Ukraine-Russia war. And so my greatest innovation is building resilience. Organizations should build resilience now. And if I'm talking about resilience building, I'm talking about operational resilience. And for operational resilience, we can look at it in several ways. We can look at disruption absorption capability, and we can also look at recovery capability. And in all these, we have several strategies. We have what we call the proactive strategy and the reactive strategy. I believe that most organizations at the onset of COVID went by the reactive strategy because production lines were shut, they were not getting imports, and therefore they have to move with ad hoc measures, but those ones are not sustainable.
Thank you. Thank you so much, Prof.
Okay, fine.
I think what we are picking out is that COVID has also brought very positive consequences. Now we know about supply chains. And so just moving on to Dr. Winnie, let's hear about how do we really make sure that our health systems and supply chain systems are resilient? He had already mentioned some of the key issues, but in your institution, what do you think we can put in place to ensure that we also have resilience in our operationalization?
Okay, thank you. And evening all. So my name is Dr. Winnie Nganga. I'm the chairperson of Kenya Association of Pharmaceutical Industry, KAPI. And I also work at GSK as a Regulatory Affairs Director, and I'm a pharmacist by profession. So as he's speaking about supply chain, it really calls to we woke up with COVID because we learned that the world was not equitable. The world was not fair. We saw a lot of vaccine nationalism, but how do we get out of that, and how do we grow ourselves as a nation, as an East Africa community? So a lot of, from an industry perspective, what we learned is around partnerships. How do partnerships accelerate research, development, and manufacturing. So there's need to foster more partnership, private-public, even private-private. We saw a lot of private-private, even manufacturers working together to actually, develop a vaccine involving the academia. So a lot of partnerships are key in accelerating R&D and also accelerating manufacturing. Supply chain disruptions did affect the production and distribution. How, I think my colleague has mentioned, we had shortages of raw materials, intermediates. It actually affected all essential medicines, not just the lack of the vaccine. How do we build this? Just as he said, we need to strengthen. As we are building up manufacturing capacity, we also need to strengthen the supply chain systems. The other point is on regulatory adaptability. This was key because that's something we learned that was critical to ensure that the products that are coming in the market are safe, efficacious, and of good quality. We saw a lot of adaptability with the health authorities working with the industry to just speed up even production and ensure that the patients do get access to this vaccine. So a lot of regulatory adaptability is needed as we prepare, let's say, for the next pandemic. The last point I have is on vaccines. So without enabling people, we need to have build trust within the to ensure that for a vaccine or a supply chain to work, we need to make sure that the patients buy into what it is that we are providing. So building trust even with the public, that's also key.
Thank you very much. Dr. Winnie, yes, moving on, please introduce yourself and tell us how else we can be able to build resilience in our systems.
Thank you very much. My name is Majid Twahir. I've been in the health industry now for about 30 years. How do I describe myself? I'm a nephrologist by background, but also have, I came to Strathmore as one of the first students to do an MBA in Strathmore. And then I did my doctorate in business administration. So I sit on both sides in healthcare and in management. I've been from a junior doctor to running a hospital. Currently in my semi-retired position, I also teach at Strathmore. I teach operations management, change management, strategy, among others. So I think first of all, what has COVID shown us? Some of the things that we have always taken for granted were brought to light. For example, we talk about telehealth. I think teleconsultation, not telehealth, but consultation has always been there. People have always called us doctors and asked, I have joint pains, what should I do? That was a consultation, it was by phone. The bigger issue was now, how do we monetize that so that I can get paid for that consultation? I think that came a lot more in COVID era and how to monetize that now. When you look at now the entire telehealth, so starting with that teleconsultation, then we start wondering now, how do we build the diagnostics into it? When you talk about telediagnosis, how do I have my picture archiving and computerized system, my radiology information system, so that an X-ray that is taken in Kisumu can be read in Nairobi. So that was already going on in small areas, but now that expanded a lot. And then we discussed about how to have collection centers of laboratory. Now we are now talking about how to diagnose and high definition cameras, which were happening in ophthalmology and retinal photographs. Now we are institutionalizing it and expanding it and scaling up to that. Now we're going further and asking, how can we now intervene? Now we are going to robotics and remote surgeries and so on and so forth. So I think for me, this is accelerated progression of what was already happening, but at a very, very slow pace. Now, together with that, leveraging on that was also education related to and communication in general, where we used to travel very many kilometers to attend conferences for CPD. Right now, hardly anybody needs to travel. We have a lot of video education going on, both at junior level as well as very senior continuous professional development. So for me, there is an entire spectrum of continuous improvement. One last thing is we should not be unfair to ourselves. When disruption came up, the first thing we had is we were not able to import masks and surgical gowns, and we started manufacturing our own. And initially we laughed at the quality of that stuff. It was unusable. I think that was being unfair to ourselves because we built on that. The kind of quality that we have now has actually or accelerated us to becoming an industrial nation, as we had predicted within Vision 2030. By the year 2030, we are making a lot of our own things. There are people who made ICU beds, Juakali. Instead of laughing those guys, is can we pick that, formalize it into an R&D, get feedback, put standards, and against those standards have a continuous improvement program. So for me, I think COVID, there's a major silver lining in it and a great opportunity for us to improve and to continue on this trajectory. Not that now COVID seems to have disappeared, that we stop, but continue on this trajectory of being self-sufficient. Thank you very much.
Thank you, Dr. Jahid. Just to build on that, moving on is really to ask ourselves, does telemedicine work in every circumstance, in every context?
Yeah, so my name is Dr. Noel Orata. I am a consultant pathologist, the current chair of the Kenya Association of Clinical Pathologists. I'm also a lecturer at one of the medical schools. I'm a co-founder of a health tech company which offers pathology services remotely, which I think also came through during COVID. And I'm also the clinical lead for Open Fences, one of the course Expo. So looking at COVID from the diagnostic space in particular, I think there was a lot of disruption. Number one was learning. We were dealing with a disease we hadn't had dealt with before from even a testing perspective. There were new protocols coming in from WHO. The government had to adjust all the machinery which could test for TB to now begin to test for COVID, SARS-CoV-2. We had to get the consumables. Again, there was also a disruption with supply chain. And of course, coordinating all of this through government because, in the beginning, they had to get all this data and it was directly to Ministry of Health. So I think it was a disruption in the sense that it was not business as usual with regards to labs. The result of that was that there was a lot of great coordination. So the country then nationally was able to coordinate this. From a diagnostic perspective, we were even dealing with WHO and international level because we had to certify testing to allow traveling. So for us, it changed the game in the sense that we had to bring our standards up very quickly to international levels to allow traveling to continue. We were coordinating with also Kenya Airports Authority. It brought a new mechanism of working nationally. The other thing that happened is we got a lot of partnerships, a lot of public-private collaborations. Private sector was able to scale up very quickly. However, they needed to leverage on government manpower. And, all of us in the lab space had to undergo testing. We had to be taught how to do these things, accreditation. That was very important. There was a shared response. There was a better coordination between facilities and data management and, feedback back to government, and it was both ways. And of course, from a pathology and medicine perspective, we were doing telepathology. So there was a lot of learning for us. I think the world was undergoing a global experiment. It was new for everybody. So we were all learning as we go. And I think it was nice to see that we actually brought up our standards, both from the private sector, public sector. It was amazing to see the conversions happening. As pathologists were thrown into, this interesting testing arena, and I think we handled it very well. So kudos to the government, and I hope that we can use these frameworks to better laboratory medicine.
Thank you so much. I think what we're hearing is that COVID had very negative impact. It disrupted our supply chain, but also a lot of positive and intended consequences that are coming across. Being mentioned just in terms of coordination, we normally think that private institutions are in competition, but now we can hear that even there was a lot of private to private partnerships, and also a lot of coordination, a lot of learning, a lot of training, a lot of spring up innovations in terms of making Juakali beds and making sure that given the teleconsultation that we normally have, I'm sure people in this room, when you have a patient, the first thing you think about is, I have a relative, I have a colleague who is a medical doctor, let me call them and find out what their advice is. And so moving on, please introduce yourself and tell us how your institution really had to cope with this.
Good evening, all. I say good evening because we are almost nearing the end of the day now. So my name is Vinod Guptan, and I'm the CEO at MedSource Group, which is an innovator and disruptor in the supply chain industry in the whole of the sub-Saharan Africa. Apart from that, I'm also one of the directors of Kenya Healthcare Federation, and I chair the supply chain committee as well. So coming back to the question, we are all human beings. COVID or no COVID, we have been given brains and we keep thinking and will continue innovating. So there's been a lot of innovations that has happened. We would never have driven a car without a wheel. So all that has come through. So coming back to MedSource, it's an ERP platform that gives visibility of all products related to the healthcare supply chain. Together with visibility, we ensure that the patients in the last mile are able to access affordable medicines with an assured quality. So this is what we do. And how do we do this? So we have brought together a lot of suppliers that are vetted on the platform, offer the services of the products on the platform, and give assured quality products. And because of the suppliers coming on the platform, we have customers that we call members on the platform. So it's a very closely knit community, and hence there is an aggregation of products or aggregation of orders, which we are able to pre-negotiate good prices for the consumers, for the customers. And going from there, we have been able to reduce the price of medications to the last mile customers from almost 8% going down to now 33%, which in itself is a big chunk of the spend that many patients do out of pocket. So going from there, and speaking of taking the cue from what Dr. Twahir mentioned, yes, we innovated. So our platform also we innovated into producing gowns and other PPEs in this market. So our platform gave visibility of what product is available, with which supplier, at what prices, ensuring that it's not everyone that came in and supplied. So there could be a lot of wrong products or bad quality products also that could be traded. So we had quality products that were traded on the platform, and this ensured that we had better patient outcome ultimately. So this is what COVID, what we disrupted during the COVID period. Apart from that, we continue innovating as well. There's plenty of solutions.
Thank you very much. I think let's move on to the next speaker, please.
Thank you. I'm Vinesh Bhatti from Varian Time, the country manager. Listening to my colleagues and understanding of different challenges and innovations that we are giving to the forums that are sitting here, I think so. Varian Time, with its footprint within the region, and how are we giving the supply chain end-to-end solutions. Our focus has been always been in country, with position of 8 countries that we are working with, and how have we managed to give solutions to products of healthcare, pharmaceuticals, health commodities, reaching to the last mile distribution. Our expertise for the last 35 years in this industry of Varian Time and supply chain solutions is to give the product at the level of the countries where we're working. Different areas within the region have been mentioned, difficulties of reaching, managing the cold chain, managing the last distribution, warehousing, cold chain monitoring. I also understood data challenge has been mentioned since morning. This is where we are also trying to give a better support, a better basic solutions, like Varian Time has already introduced in Ethiopia, Uganda, and Kenya as well. Our own app has been mentioned a couple of times within the different forums here. Ours is very basic. Also somebody touched about the technology of the smartphones. but we made it very simple, basics, where the counties could place orders on the app, stock management, no waste going out. So those are the innovations that we as Freight in Time are doing. We are actually supporting the cold chain in counties. Maybe the power is not there, the generators are there, small fridges are there. This is where we have gone to the last mile. We're having a small pickup where it has gas cylinders, technician guys moving from one county to the other county to ensure these gadgets are working, the fridges are working. So that's whole supply chain solutions we as Freight in Time are giving out. Our last mile distribution has been very achieved. I will give you some very quick projects that we are working with. We are working with a global fund in Ethiopia. We're doing the Pfizer distribution. Even to give a solution of cold chain materials, like for example dry ice. Different vaccines require different magnitude of temperatures, and we are giving them a solution from here, from CO2, supply of CO2 into Ethiopia. That's what we're already planning to. So working with public-private partnership in Ethiopia, that's what we're doing, engaging as Freight in Time in there. We're also doing, we have cleared the first project of zipline drones, which I have just cleared this morning. They're in our warehouse. We have a project which is going to be going live, I think so, the second week of June in Kisumu County, where zipline, I'm sure if my Rwanda colleagues are here, they've already been dealing with zipline for quite some time. And this project has now come into Kenya, the first project going live in June. That's going to be in Kisumu County, where drones, the control tower, the management of the commodities within the area of Kisumu County, that's going to take place very soon, and it's going to be it's a fantastic government project in Kenya. The last one is also in Uganda. We're working with Gavi project with the National Medical Center with the government. So yes, challenges are there. Government restrictions, warehouse challenging, last mile distribution, temperature control data. That's where we've put our hands on, really on the ground, to see how we could manage and work with the teams. Training is required on basics. Technology is very big, very huge. It's a monster. My other last panel here, my friend from India was talking about telemed. Yes, it's fine, but this is Africa. That also needs basics to understand the supply chain solution. So the upper stream, where containers, shortage of containers, air freight has really gone up. It's really a challenge, but we're trying to manage where we can with different shipping lines, airlines, to bring this stuff. During the COVID period, we are the GSA for Ethiopian Airlines, and we did about four flights a day of movements with Ethiopian Airlines as medical healthcare support. And yeah, it's possible. Supply chain solution is there. It's a matter of what do we want? What is the scope? So we could supply that. That's the expertise of Freight in Time.
Thank you very much for your contribution and the way you have networks in East Africa. If we are talking about bringing East Africa being a hub for medical tourism, then we need to be able to meet the demand of the likes of Fatuma and the rest of the patients who are seeking care in East Africa. Yes, please.
Good evening. My name is Ansu Dukure. I'm the Managing Director for Varian Medical Systems. We are a US-based equipment manufacturer, specifically linear accelerators for the treatment of cancer and radiotherapy. So what didn't COVID affect, right? The world stopped. 2 years ago, the world stopped, literally. Being a manufacturing company, it meant we didn't have people in the factories to continue the work. And when we talk about supply chain disruptions, often we think of products or merchandise, right? We don't think of people that actually, in our case, that will have to travel to go and install the equipment, train, and all these other aspects. So it really did disrupt our services. And to this day, we have backlogs that are 6 months. So it continues. What can we learn from it? I think, we all have similar experiences in terms of how it affected us. But I think the most important lesson is to be local in every aspect, right? To be local in every aspect. So as Africans, we should demand that multinational corporations build capacities within the continent. Because sometimes it's easy to get from here to Tanzania versus sending someone from Paris to come here. They will have their biases and challenges that they may not want to come at certain times. So we need to be local and ensure that we have those capabilities in country. And I think, for us as a company, we are a global company. We don't have local entities in every part of the world, but I am happy to announce to you all here that Kenya is one of 4 countries in Africa where we're local. We actually have a Varian entity in Kenya here with local Kenyans that are trained to install, service, maintain, and do every aspect of the work when it comes to our equipment. And we're looking to expand and build on that. I think that's the model, right? Before COVID, folks that had the privilege to access medical services overseas could just hop on a plane and go. When COVID came, I know of people that actually lost their lives, right? They used to go to India for treatment, and all of a sudden they cannot jump on a plane to go, right? So again, that's another lesson learned. So for us, the supply chain disruptions partly affected existing businesses, but the domino effect that has come as a result of that, we've seen increased interest now with countries that are looking to build capacity, right? So they've taken it seriously to have local capacity. So that actually has continue to affect our backlogs that we have. So that increased interest. So in short, COVID has had both negative and positive impacts, and I hope that we can drive the positives to ensure that if it happens again, because who knows when the next pandemic will hit. If it happens again, are we ready? Right? Will the effects be worse or will they be less? So the lessons that we learn and what we implement will give us the answers when that next pandemic hits.
Thank you very much. Just want to build on to what Dr. Tahir mentioned in terms of robotic surgeries and telemedicine. And my question is, these innovations, are they really for people in marginalized communities? And what innovations can we have to be able to reach people who do not have even the basic phone?
Thank you. I think some of the things that I do a lot of business consultancy. I think one of the things we underestimate is our intellectual innovation that we have had, and how much we are able to sit together and come up with a lot of ideas. I may not have a solution, but 3 of us sitting together come up with a solution. I think syphilis a few years ago was a deadly disease. People died of syphilis. Right now, it's a very easily treatable disease. So similarly, if you look at robotics in that context, at the moment, it looks like it's a very far-fetched thing. There are developing countries that have already started doing robotic surgery now. So there's no reason why somebody in Northeastern should die of something that somebody in Nairobi can sit and undertake surgery while in Nairobi and have a team that is trained in Northeastern to assist in that surgery. Because robotics has 2 teams, the primary team and then the team in the field. So there's no reason why we cannot do that. So for me, the intellectual innovation solutions are here with us. If we sit 3, 4 of us together, we'll figure that out. And I think it's very, very possible. Thank you very much.
Thank you so much, Dr. Just to take another round of input is, just want to pose this question that, yes, we have learned lessons. We have had different innovative ideas in our capacities, in the different institutions that we are representing here. How do we embed them in the institutions so that we have a long-lasting resilience in our systems? So the issue of embeddedness.
I think you should permit me to make an important point that I also see it as resilience building. You know, the developed countries, they built this resilience long ago. You hear of United States of America, the European Union, and then we were talking about African Union, but it never came up. But then imagine a continent of Africa without boundaries, where businesses can thrive without a complex custom procedures, high expensive tariffs, moving from one African country to another. The processes you go through on the road, etc. And that is hindering our businesses. For example, we are talking of the health sector, we are promoting the health sector, we are building resilience, we want to manufacture our drugs, we have very good health systems. But at the backdrop of this is that definitely they should be sustainable. There is no hospital here that will be doing business and then will be making losses and can continue. I have my doctors here. Please tell me whether if you are making losses, you continue. No, you should be sustainable. And so this introduction of African Continental Free Trade Area, which has the headquarters in Accra, Ghana, I think that East African community, because the leaders here are coming from the various countries in East Africa, I believe you can also speak to your authorities that this issue should be taken seriously. The tenets should be accepted. It is going to boost trade among African countries. Traveling from one country to another will be easier. In fact, I'm a Ghanaian, but a professor at Strathmore here. I've compared the health sector in Ghana and that of Kenya. I must say that of Kenya is at a higher pedestal than that of Ghana, because I've seen, and I have also gone through the internet, and I was amazed when I visited a few hospitals here. In fact, I'm not just saying that to compliment so much at the expense of others. That is why I'm not mentioning names. But the few hospitals I visited, if I compare with those in Ghana, I say, oh, Kenya is leading. But now, how can it be so easy for someone from Ghana to fly to Kenya to take advantage of the good health services here? If it is not easy to travel from one country to another, then what are we talking about? So I am just making a point that it's another form of resilience, that we are all coming from various East African countries. We speak to our health, our sector authorities to convince the head of states to make sure that start from East Africa. For East Africa, just accept the after, and I believe that it can boost trade among, East African countries, eventually African countries. Thank you so much.
Thank you so much, Dr.
Okay, so riding on what my colleague has mentioned, so East Africa, we really have to build each other. We can't have Kenya only doing better than, we are East Africa, we have to work together. How do we do this? It talks about policy. How do we grow our policies, regulations to ensure that it is supporting us to grow? That's a real major point, because without policy, without the right regulations in place, then there's nothing much we can do as a region, more or less. In terms of scaling up, I think local is, it's important to remain local, as he said, but how do we scale up manufacturing? How do we scale up our hospitals? How do we become more self-sufficient? That's, I think, a big ask, and it requires a lot of public-private partnership. We need the government to work together with us so that we have stronger East Africa as a federation. In terms of supply chain, maybe looking at the technologies that are available, we've talked about the drones. So how do we also scale this up in a national level rather than have it being done probably by a private company? How do we bring this into a national level so that we increase access? So those are the key questions and takeouts.
Thank you so much, Dr. Rintowe.
Just very quickly, because I'd spoken earlier. For me, I think it's important for us to work towards self-sufficiency and self-reliance. We can complain about vaccines, apartheid. I think that's looking at it the wrong way around. I think what we need to do is, can we be self-sufficient, that we stop complaining and we stop naomba serikali at a global level and just be self-sufficient by ourselves. And we can do it collectively. I don't understand why every single hospital has to do kidney transplants and how every single hospital has to do cardiac surgery. So similarly, not every single East African country has to do the same thing. Us in Kenya, we could be the specialist in kidneys. Uganda could be the specialist in cardiac. Rwanda could be the specialist in ICT. We can have centers of excellence that then we can borrow from each other. Then, as Professor says, then we try to figure out now the logistics of movements. How do I pick up that brain of Rwanda in ICT, and how does that fellow in South Sudan pick the brain of the Kenyan in kidney transplant, and so on and so forth. So we can develop national centers of excellence. This is what Kenya is known for. This is what South Sudan is known for. This is what Ethiopia is known for. And we share these resources across Africa. Thank you.
So I think as a technocrat in the diagnostic space, I think looking at disease in the healthcare space, the one thing we need to do is surveillance. You cannot manage what you don't know is coming. And like he has said, we can actually spread this and look at different diseases in different regions and strengthen that so that then we can share information. And so surveillance is important. I think another very, very big one is governance and leadership, marrying that with policy, regulation, and legal frameworks, so that you can embed this. From my personal experience, when we were setting up the technical working groups for COVID, the way, the logic and how they came up with regulatory and policy that we must wear masks, everyone had to comply, right? And I think it saved us a lot of, hello? Yeah. So it saved us a lot of deaths because we were able to put in public health interventions that then covered all the communities. So I think for me, I look at it from a three-pronged approach: surveillance throughout, centers of excellence, governance and leadership, and then policy, regulation, legal frameworks.
Thank you. So really, the leadership and governance is very key. As we also remember the past panel that was also mentioning issues of corruption. And so when we have good leadership, good governance, we can be able to get rid of the corrupt practices that can also find themselves in our very good innovative our ideas.
Yeah, so most of us sitting in this room have either said the world is a global village, or has heard somebody speaking about world is a global village, or we also say small world. But really in the business sense, or in supply chain, shortening of the gap, or strengthening the healthcare supply chain system, I still believe we are way beyond all these statements that we continue making. So maybe if I look at it, what could change or what could we do to do better is probably integration, data sharing, knowledge sharing, use of AI. Artificial intelligence is available everywhere. Our passports are known all over the world. They know where we traveled, and Google knows which phone call we made and what I ate in the afternoon. So if that is the case, and there's such a lot of data sharing, can we use AI more to strengthen the supply chain gaps? Can we use data sharing to ensure that those gaps that are available in the market with regard to supply chain can be fulfilled with information that is flowing throughout the system? So this is where I would stop.
Thank you. You mentioned a very important issue about data sharing, and we know that data can also be abused, especially personal information. For those of us who are Kenyans, we have received notification of parties we have not even registered for, we are not members of. So I think, how do we put also measures in place to ensure that this data is safe and it is used for the right information? The panel before the last one, we had an issue about how patients who are coming in, maybe from another country, they go back without all their tests, without all the information. So it becomes very difficult to follow up these patients and make useful follow-up treatment. And so that would really be an interesting entry point to ensure that data is shared online, but how do we ensure that it is safe and it's not abused?
The technology at different global is coming out with different new technologies coming into the system. Within the East Africa region where we are present, I think so. We as Kenyan, I would say that we're trying to really move fast to understand those new technologies, not understanding the basics, what is required within the countries that we are. I'll take a very good example. There was this last mile distribution in Kenya, and the app we generated was implemented quickly in Uganda. And we worked with Gavi projects for almost 2 years to do health commodities and vaccination distributions with cold chain monitoring. The same has adapted in Ethiopia. And with a span of where we took 9 months to set up in Kenya, it took about 4 months in Uganda. And now in 3 months, Ethiopia is so much into that little concept that we have given them. So that's the belief of Freight in Time, to give solutions, basics, instead of running to bigger technology, because our region, Ethiopia, Djibouti, where we are present, South Sudan, basics is what is required to move the logistics supply chain solutions very quick, very fast, understanding. If I'm going to put high technology of understanding of data collection, management of cold chain within the system, first, somebody did mention language is a barrier into situations like this, but our basics could do that. In the 8 countries that we are working, we have a local expertise, country managers who are running the show. That's added a lot of value. With about over 800 staff, we might be having only 3 expatriates working with us. So local is what we are believing. In country knowledge, our local people. It was mentioned that we have very good university students. With Kenya, I'm almost having about 15 young people working with me, and it's amazing. They just need a bit of direction where we're going. So I think the supply chain solution is cute. It could be ugly, but where do we need the support of the government, the humanitarian organizations who are working with? We are already working very aggressive with local suppliers who are bringing a lot of raw materials and finished products in country. I would mention a few bigger suppliers like Crown Health, Harleys, who are medical firms. We are exporting to West Africa. We are also doing triangle business. What do I mean by triangle business? It's like the royal family in Emirate had given us a project that we could work with. So picking products from China, almost 42 containers, and giving it to Nigeria and Ghana, and that happened within 6 months. So supply chain solution is there. It could be complex, but it's where do we put our solutions required. So local expertise makes a lot of difference in country.
Thank you. Thank you so much.
I agree with all the policy suggestions. I can tell you from foreign company manufacturers' perspective, nothing is more frustrating than trying to navigate the different regulatory frameworks across the different countries in Africa. So to what the first gentleman spoke of, having some type of standardized policy as it relates to imports specifically, right? So you can build all the resilience in Kenya that you want as a foreign company, but we're a global company, right? We want to go beyond Kenya. So if you have to replicate that in 54 different countries, you can understand the frustration. So I think we need to get not only the national governments buy-in, but at the African Union, right? So maybe we need to scream louder. These institutions or these policy frameworks that they have with the Africa Continent Free Trade Act, with the headquarters now in Accra, has to stand for something. Movement of goods and services has to be eased, and this is the only way we can build a resilient system. What I see now actually is countries looking to other countries within the continent to learn from how they've done it and what they have done. This has to be encouraged. We need to see greater collaboration in that regard, because the countries within Africa are more similar. In the past, you will have projects where they will have to travel to the West to try to replicate what they want to do, and it may not necessarily have the same elements that lends itself to all the cultural and the other dynamics in Africa. So it's encouraging to see Kenya actually leading in a lot of the areas when it comes to healthcare. And for those of us that are going to other markets, we're actually championing that. We're holding the Kenyan flag to say, hey, let's go to Kenya. We'll show you how we did it in Kenya, and you can learn from that. So I think we need to continue that, but the governments definitely have to make our life and our work easier by making sure that it's easy to do these types of engagements across the continent.
Thank you so much. Just to wrap up, there are 4 issues that are picked up if we have to really build resilience in our healthcare system. And one of them is really south-to-south learning, keeping it local, ensuring that we learn from one another on the continent. We are well-resourced in terms of intellectual capability, in terms of innovativeness, and we need to be able to exchange this information among the African countries. Issues of leadership and governance, we cannot run away from that, because if the legal and regulatory framework is not working, then it will not be possible to do business. The other points that are picked up is the issue of partnerships and collaboration between not only public and private, but also among the private to private sector. Last but not least is really the issue of surveillance. Keep looking for this, anything that's coming up. Be vigilant, be on the lookout of things that are popping up that can really be cause disruption to the supply chain. I don't know, in terms of order, in terms of importance, what do you think really should be the takeaway message from this panel? Are we saying that we need to be able to speak to our ministers of health, our heads of countries, so that when they are at the AU summit, they're able to bring this out and really build the capacity of the African CDC? Or are we saying that we need to look at issues of partnerships locally? So if you feel that leadership and governance is very key, please, I will ask you to just raise up your hand. Okay. Partnerships, public-private, private-private. Okay, fewer hands. South-to-south learning, keeping it local. I mean, this will really address the issue that she raised, the issue of inequity. I mean, we saw that vaccines had to go somewhere else before they were brought to Africa. And when they were brought to Africa, we learned that they had a 3 months expiry date. So we really need to address issues of inequity. And I think south-to-south learning and keeping it local, building our own capacities is very important. I just want to thank my panelists for such very fruitful, engaging discussion, and also for the other delegates, really, for staying until this time. It's really building resilience. Thank you so much.
Thank you so much, esteemed panelists. Another round of applause, ladies and gentlemen. So I'd like to really appreciate each one of you at this particular time for having had time to join us today. Kindly, tomorrow, let's dial in early so that join in early so that we can keep in time. So I'd like to appreciate Strathmore University Business School, our partner, Kenya Healthcare Federation, Open Fences, the UN SDG Partnership Platform, and the Ministry of Health, our host, Strathmore University, for hosting us. I'd also like to appreciate our lead sponsors, that's Medihill Group of Hospitals, Wasi Health, Farm Access Foundation, as well as our standard sponsors, Varian, UNICAF, Qatar Airways, Imperial Managed Solutions, FW Africa, Current Hospital, Gateway Children's Hospital, the Aga Khan University Hospital, HealthX Africa, Penda Health, Viberg, IC Line General Insurance, Life Care Hospitals. Kindly, all these sessions that we've had today, they'll still be online at our online portal of https://health.expo.flo.bz. You can join in, dial in. So I'd like to appreciate all our regional partners who spoke here today, all our panelists who took us through the medical tourism and East Africa as a hub for specialized care. Also appreciate all the panelists for the innovations in healthcare, and also the final bit of the logistics in healthcare. As a snapshot of tomorrow, we'll have the future of healthcare investments in Africa, picking up from where we've left off today. So you guys do have a lovely evening and see you tomorrow early enough. Thank you so much.